Did you know that diabetes can cost you your vision and is one of the leading causes of progressive vision loss? I'm Dr. Andy Rosenfarb. Today we're going to take a deep dive into diabetes and how diabetic retinopathy can potentially steal your sight without you even knowing it. Diabetes, as you might know, is one of the leading causes of health issues in the United States, leading to things like stroke, heart attack, obesity, and a whole host of health issues. Diabetes is considered to be one of the most controllable diseases out there through diet, exercise, so on and so forth. And diabetes can and often is genetic. So let's talk about diabetes and how it can affect your vision. What happens with diabetes is the blood sugar is dysregulated. Now we have what's called insulin, which is a hormone that is secreted from the pancreas, kind of in our innards, in our insides. So the pancreas secretes digestive enzymes. It also secretes insulin, which helps keep the blood sugar stable. What insulin does is it attaches to the sugar, glucose, that's in our bloodstream, and brings it or ushers it into the cells to be used for producing energy, right? That's how we make energy, by burning glucose with oxygen. So this process doesn't happen in folks who are diabetic, either type 1 or type 2. This blood sugar sticks around in the blood, and the lack of insulin will not bring the sugar into the cells to be used for energy. So that's what diabetes is. Some people early on, when you have early insulin resistance or dysglycemia, it's very controllable, and most of these folks don't need medication. You don't need injections, you don't need medications like metformin. You can manage it through diet and exercise. It's possible to get to a point where it's non-manageable, or maybe you're born with an autoimmune condition where there's type 1 diabetes. Either case, if you're at that place where you're dealing with medicine, you need to take medicine for your diabetes, or you're on the insulin pump or doing insulin shots to deal with your diabetes, you are at high risk for developing what's called diabetic retinopathy. Now, diabetic retinopathy, what happens is the blood vessels get very stressed out from the fluctuations of blood sugars, and they start to break down. Now, when the blood vessels or the vasculature of your eyes will start to break down, specifically in your retina and your macula, what happens is you can get leaking of blood, leaking of fluid, and the blood vessels will start to break down. You'll also have neurodegeneration that usually starts with patchy vision and peripheral vision loss, also night vision loss. Then things can start to get spotty and encroach into your central vision as they progress. You're also at high risk for retinal bleeds and retinal edema. That's fluid that builds up around the eye. So this is what happens, and if you have diabetes, you may or may not be aware. If you have diabetes, you should be getting screening regularly, at least once a year, to make sure that your retinas aren't getting beat up because of the blood sugar and insulin surges and bottoming out inside your system. So our treatments, using acupuncture, supplements, alternating current stimulation, hyperbaric, is incredible for helping diabetic retinopathy. Of course, we need to manage the diabetes and help you through supplementation, diet, exercise, and work on stabilizing your blood glucose levels as well as your A1C. So very, very important. What we can do is help the vascular system repair and recover and help preserve your retinal nerves, which are your photoreceptors, your rods and cones. I would say in my experience that diabetic retinopathy is without question the fastest responding of all retinal conditions that I work with. We have 100% success in terms of improvement. Does that mean we're curing them? No. These are long-term chronic conditions that will tend to go up and down, especially if you're not taking care of yourself. You'll see more signs of this. But we're very, very effective in terms of stabilizing diabetic retinopathy and preserving vision long-term. So if you have diabetic retinopathy, or you know somebody who has diabetic retinopathy or suspects that that might be an issue, feel free to reach out to us to ask questions. We're happy to have a conversation to find out if or how we can help them. Maybe it's you, maybe it's someone you care about. Have them reach out to us. I'm Dr. Randy Rosenfarb with AccuVision Recovery, where your vision is our mission. We'll see you soon.